You may have heard the term nipple confusion associated with going back and forth between nursing and bottle feeding. And a lot of parents are hesitant about introducing a bottle because they're afraid that their baby won't nurse as well. And for most babies, this isn't a problem as long as nursing is well established before the bottle is introduced. A good rule of thumb is to wait a minimum of 2 weeks after the baby is born and to make sure that nursing is well established before you introduce a bottle. Of course, there are circumstances when bottles have to be given before this point though, like in the hospital if the baby has low blood sugar, or if you're not making enough milk, or your pediatrician recommends supplementation for whatever reason. Sometimes bottles have to be given sooner, and still, those babies may go back and forth between the two and do just fine. It doesn't necessarily come down to the type of nipple on the bottle. It comes down to the fact that when a baby breastfeeds, they have to suck for like a minimum of 30 seconds and sometimes for minutes before milk starts actively flowing. This is when your milk lets down, and you'll notice that your baby sucks and swallows during letdowns, but then in between the baby has to continue sucking in order to cause another letdown to happen, and then there will be active flow again. When a baby is sucking from a bottle, it just is active and constant flow. They don't have to work for it. And so sometimes some babies can become lazy suckers, where they rely upon that and they don't really want to work at the breast to get the nutrition that they need. Again, for some mothers, it's a necessity to get their babies to take bottles, though, because they're going back to work or school and they're leaving their babies in the hands of caregivers, and they need a way to feed them when they're not there. There are a ton of different bottles on the market, and it can be a little overwhelming when you go stand on that aisle at the store and look at all the different brands and all the different types. And really, you can start with the most economical bottle and nipple first. Most babies will do well with that. And then if your baby's having issues, there's a couple of things to explore before you go buying another type of bottle. Sometimes it's the temperature of the milk or the formula inside the bottle. It's either too hot or too cold, and so you can adjust that temperature if necessary. Sometimes it has to do with the fact that babies that are drinking bottles swallow excess gas, and so burping becomes extra important for these babies. And a third thing to think about is the flow through the nipple. Most generic bottles are set for infants and newborns, and then if you give a 9-month-old an infant bottle, they may fuss because they're not getting enough flow through the nipple. The hole is smaller, and so it controls the flow, and you'll need to get a nipple that's more appropriate for an older baby that can handle faster flow. If you have more specific questions about it, talk with your baby's doctor, and if you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.